Let's decode PCOS today. So, to understand what's abnormal, we'll have to understand what's normal first. So, let's take it quickly. A normal ovarian cycle lasts up to 28 days. What happens is, ovaries, it produces eggs which mature into follicles. What are these follicles? They are liquid membranes, granulose cells with receptors at the surface called theca cells. They produce estrogen, progesterone and inhibin. This inhibin, it signals pituitary gland. Okay. Now, what does pituitary gland do? Very important. It secretes two hormones, FSH and LH. FSH acts on the first 14 days in the ovarian cycle. It helps in the growth and maturation of the follicles. So, these follicles, along with their growth, simultaneously they release estrogen. So, when in the blood estrogen levels rises up to a certain level, it signals pituitary to release the other hormone, LH. Now, what does this LH do? First of all, it is secreted in a very large quantity. It acts on the most dominant follicle, it ruptures it, and ovulation occurs. Now, after ovulation, you know the process. What happens if fertilization occurs? And if fertilization does not happen, you get your periods. Now, what happens in PCOS? PCOS में the pituitary gland, it releases abnormal amount of LH. So what happens is, there is no maturation of follicles and there is no ovulation. It disrupts the ovarian cycle, which leads to infertility, late periods, etc. Okay? So this is what PCOS is. Now, why does it become more dangerous when PCOS is accompanied by insulin resistance? PCOS में क्या हो गया? You have high level of LH. Insulin resistance में क्या हो गया? You have high level of insulin. So high level of insulin and high level of LH, they promote high level of testosterone. Now, is testosterone bad? No, it is not. But it is present in two forms, bound 80%, free 20%. The more bound it is, the better it is. But जब insulin levels high होते हैं, तो SHBG नाम का जो प्रोटीन होता है, which bind testosterone, वो कम हो जाता है. So what happens is, free testosterone increases, which leads to acne, hair loss, hair growth in specific areas, and other problems. ठीक है? And this also leads to increase in the weight. Now, what are the causes? The actual causes are still unknown, but hereditary and obesity. These are the two causes that can be connected to it. ठीक है? Now, coming to the management of PCOS. Suppose you go to the doctor. You take medications, okay? Doctor will give you medications. What medications can you be on? एक तो hormonal birth control, which help managing your hormones. Second, anti-androgen drugs, which will help in the hair growth and acne. Third is metformin to help increase your insulin sensitivity. Fourth is fertility medications to help in ovulation. But there are certain lifestyle changes also that you can do. First is, of course, diet. You should have a balanced nutrition. Also, there has been case reports that have shown that low carb diet helps. But when I say low carb diet, I don't mean keto. Any low carb diet with good glycemic load will help. Also, you should consume less processed food. Then exercise. Exercise will help you even if you are overweight or you are not. If you are overweight, it will help you control your weight, which in turn will lead to managing insulin levels, testosterone levels. It will also help you to recover psychologically. And if you are not overweight, still it will help you maintain your lipid profile. It will help you to maintain your blood pressure. So what happens is, exercise, especially resistance training, you work on those muscles and you increase your insulin sensitivity. Third is stay hydrated, okay, as much as you can. Water helps. Fourth is sleep levels. Sleep 6 to 7 hours. What happens is, when you sleep properly, your stress level decreases. What happens when your stress level decreases? Any kind of stress, physical, emotional, hormonal. Stress leads to increase in the cortisol levels, which will in turn lead to hormonal imbalance. Okay? So today we learned about normal ovarian cycle, PCOS, PCOS plus insulin resistance, and management of PCOS. Let me know in the comment section if you want to know anything more. Thank you.